Course remains top of mind, but that's not the only illness circulating in schools right now. Sonica Bargo joins us in the newsroom with more on what else is making kids sick. Sonica.
Dennis, last winter with kids at home and COVID precautions in effect, we didn't really see a typical flu season. But this year it's back and doctors are seeing more kids getting sick. The flu season in 2020 was nearly non-existent.
We didn't see the usual kind of respiratory viruses that we typically see.
But when COVID precautions started to lift, things changed.
People kind of getting together and going back to school, daycares, things like that.
Pediatric infectious disease physician Patrick Gavigan says the number of kids getting sick with respiratory viruses other than COVID started to rise faster than doctors expected.
Usually, again, those kind of start in the winter months, but we really started seeing, high RSV activity as early as June, July.
Gavigan says one reason for the rapid rise is because so many kids spent over a year at home, mostly isolated.
Usually each year, new kids are exposed to it. They develop some immunity towards it.
Once schools return to a consistent in-person schedule, Gavigan expects numbers to settle.
My best guess is that it would kind of go back to what we had seen pre-pandemic.
Until then, families can still take precautions, just like they've been doing with COVID-19.
The usual pediatric vaccines, flu vaccine is important and helpful.
Gavigan also told me with the number of viruses going around, it can be hard to tell what your kid is dealing with. He says monitor their symptoms the same way you would with COVID, like making sure they're not having trouble breathing. Live in the newsroom, Sonica Bargo, ABC 27 News.